Medications that have a side effect of weight loss have seen a recent influx of popularity.
Some manufacturers are saying they're having difficulty keeping up with the increased demand as the medications become more normalized as a way to lose weight, even though that's not the primary purpose for them. One of the most popular is Ozempic, which is approved to treat diabetes. It's having a viral moment on social media with more than 273 million videos made with the hashtag of the drug's name, resulting in more than 1 billion views.
For more, Dr. Lisa Palmer is with us now. She's a psychotherapist and the founder of the RenewMe Center of Florida. Thanks for being with us, doctor. So these drugs are attracting a lot of attention right now. Are there dangers in using medication for something other than what it's explicitly intended for?
Absolutely. And as you know, I've been treating eating disorders for a long time. So it's not the first time that I've seen people actually try to manipulate insulin to lose weight. And so it's considered eating disordered, believe it or not, diabulimia, to be as a matter of fact. So when we see this taking place in our culture as a trend to lose weight and people, this is something that's becoming normalized, it definitely is concerning because it's eating disordered.
Dr. Palmer, does the increasing popularity and prevalence of these drugs and people using them encouraging unrealistic weight loss or body image?
Absolutely. I mean, as you know, that people have been suffering with body image for a long time. There has been a lot of encouragement to reduce weight. And now when you take a prescription medication that's supposed to be used for the treatment of diabetes to lose weight, this is very concerning because if somebody doesn't have a physical problem where they need to take Ozempic, they're taking it, are they looking at the side effects of this medication as how it can be affecting them physically?
You know, I wonder, doctor, as this idea of losing weight seems to become more accessible through medication, are we seeing more sort of fat shaming, people being made to feel terrible because of their body weight?
Well, hasn't this been happening for a long time? When people got bypass surgery, people always would gossip about them and say, well, they didn't lose weight the natural way. For some people, it is medically necessary, but I caution people, even with any kind of procedure that you might have, that can be ramifications and nutritional needs change, and you need to be aware of that. So that can affect your overall health. So it's not just the fat shaming piece, but it is how people are being affected mentally and physically by their choices.
Dr. Palmer, I actually have a few friends who are taking the shots but don't want anyone to know. And how do we as a society ditch the mindset that skinny is healthy?
That's a really good question. I mean, there would have to be changes in the consumer mindset. You have to understand that a lot of products are being sold because people have insecurities about the way that they look. And if they didn't have these insecurities about the way they look, people wouldn't be out buying these products. So consumer culture relies on people feeling bad about themselves so that they can buy these products. So it is more of a systemic issue. And I think that what we need to do is realize that and focus on our own internal belief systems and try to be positive within ourselves and work on those affirmations or get the help that you need so that you're not gypped, I guess, by these concepts and these ideas that you need to do more, to be prettier, to be better, and that you're not enough.
And social media is certainly not helping either. Dr. Lisa Palmer, thank you.
Thanks for having me on the show.